The COVID-19 pandemic has had a major effect on our lives. Many of us are facing challenges that can be stressful, overwhelming, and cause strong emotions in adults and children. Public health actions such as social distancing are necessary to reduce the spread of COVID-19. But they can make us feel isolated and lonely and can increase stress and anxiety. In light of this, Grenadians are being urged to maintain good mental health. The advice comes from clinical psychologist Dr. Augustine Panchu as health officials continue to grapple with the challenges of the COVID-19 pandemic. He says despite the current outlook, one must remain positive.
It becomes really, really important for people to be able to express their feelings. And not many, you're right, not many people have this confidant, this person to whom they can go. Sometimes it could be your pastor, it could be a teacher, it could be a friend, it could be a loved one, it could even be a spouse. But very often a lot of people don't have that. So they now have to rely upon their own internal instincts. And sometimes those internal instincts really cannot stand the test of psychological scrutiny. Build your immune system, look for something creative to do, look for someone to talk to. And if you really can't find, and it's kind of hard when you can't find, but you can journal so that you find ways of expressing yourself.
Feeling more connected and having the opportunity to discuss any potential worries and positive expression with others is essential during times of crisis. Self-care strategies are also good for mental and physical health. Failure to maintain good mental health, according to Panchu, can have serious consequences for both adults and children.
So even during this COVID time, children are hearing the news about people getting sick and they can't breathe and they are nervous, etc. And they're having chest pains. And watch this, when you tell a child that sometimes, Joe, they internalize it as real. And so they go to bed, their little brain is telling them, I am sick. So they wake up next day with what we call in psychological circles, psychosomatic symptoms. Psycho, mind, in the mind. So for them, it's real. They vomit, they have chest pains, they have pains and aches, their heart race. But when you take them to the doctor will look at you and say, no, your child is not sick physiologically. But what is going on here is a mental illness. In other words, is a mental gymnastics of the brain.
Taking care of yourself can better equip you to take care of others. During times of social distancing, it is especially important to stay connected with your family and friends. Helping others cope with stress through phone calls or video chats can help you and your loved ones feel less lonely and isolated. For GBN News, I am Rena Per Thomas reporting.